Shockingly, 90% of adults worldwide suffer from some form of gum disease, yet most remain unaware. Gum inflammation starts subtly but can progress to periodontitis, causing irreversible bone loss within just 3 weeks. This silent epidemic contributes to systemic diseases like diabetes and heart conditions. Early intervention is crucial, as healthy gums are the foundation of overall wellness. Gum disease begins when plaque bacteria colonize the gingival sulcus, the 1 to 3 millimeter gap between teeth and gums. These pathogens release toxins that trigger inflammation, gradually destroying connective tissue. Left unchecked, the infection spreads deeper, forming periodontal pockets that harbor more aggressive bacteria, like Porphyromonas gingivalis, known to erode jawbone. Early symptoms often go unnoticed. Pink-tinged toothpaste after brushing indicates gingival bleeding, your body's SOS signal. Persistent bad breath, halitosis, suggests bacterial overgrowth, while gum recession exposes sensitive root surfaces. Unlike transient mouth injuries, gum inflammation won't self-heal without proper intervention. Inflamed gums act as open wounds, allowing oral bacteria to enter bloodstream. Studies show these pathogens can trigger arterial plaque formation, increasing heart attack risk by 25%. The inflammation cascade also worsens diabetes control and may contribute to Alzheimer's through beta-amyloid protein stimulation. Your mouth is the gateway to systemic health. Contrary to popular belief, expensive treatments aren't always necessary. Research confirms that early-stage gum disease can reverse with proper home care alone. While professional cleanings help, daily brushing technique matters more than frequency. Even electric toothbrushes show no superiority over manual brushes when used correctly. Saltwater rinses, half teaspoon salt in warm water, reduce inflammation by osmosis. Coconut oil pulling decreases harmful Streptococcus mutans by 50% in studies. Green tea's catechins inhibit periodontal pathogens, while aloe vera gel soothes irritated gums. These affordable solutions complement mechanical cleaning without disrupting oral microbiome balance. Dental researchers recommend holding your brush at a 45-degree angle toward the gum line, using gentle circular motions. Apply only enough pressure to blanch gum tissue slightly, about 150 to 200 grams. Spend 30 seconds per quadrant, covering outer, inner, and chewing surfaces. Finish by brushing your tongue to remove biofilm where bacteria thrive. Vitamin C-rich foods, bell peppers, kiwis, strengthen gum collagen. Omega-3s in fatty fish reduce periodontal inflammation by 30%. Crunchy apples and carrots provide natural abrasion against plaque. Limit sugary snacks that feed harmful bacteria, and drink water after meals to neutralize acids. Your diet directly fuels gum repair processes. Chronic stress elevates cortisol, which impairs gum healing and increases infection susceptibility. Bruxism, teeth grinding, accelerates gum recession. Simple diaphragmatic breathing for 5 minutes daily can lower inflammatory markers. Prioritizing sleep allows gum tissue regeneration. Studies show poor sleepers have 60% higher periodontitis risk. Global dental associations agree. Consistent gentle cleaning prevents 85% of gum problems. Use soft bristled brushes replaced every 3 months, clean between teeth daily, and get professional evaluations twice yearly. Remember, gum disease is reversible in early stages, but becomes manageable chronic condition if neglected. Your daily habits write your oral health future.